My name is Monica Perdomo. I am a fourth-year medical student at the FAU College of Medicine. This was written in association with Dr. Daniel Silverman and Dr. Celine Hamilton, who are associated with Memorial Regional Hospital. Today I will be discussing a case of IVIG and treatment-resistant psychosis for a child with Turner syndrome. So to start off with, psychosis is defined as a presence of false beliefs or false perceptions. In children, some causes of psychosis include psychiatric diagnosis, such as schizophrenia and autism. However, it may also be secondary to medical conditions like various forms of encephalitis. Studies have shown that IVIG has been efficacious in the treatment of psychosis in the setting of autoimmune encephalitis. Now for the case. A 9-year-old girl with a past medical history of Turner syndrome, developmental delay, epilepsy, growth hormone deficiency, metabolic bone disease, and autism spectrum disorder presented with auditory and visual hallucinations that began June of 2020. Her initial symptoms included hearing voices that repeated the word dead and told her that she would not live. The hallucinations later took the form of a man that would mock her, laugh about her parents dying, and tell her to kill them. The patient had associated symptoms of insomnia, anxiety, sadness, and increased anger. On her initial admission on June 30th of 2020, CF studies, including her cultures and gram stains, were unremarkable. NMDA, VHKC, and GAD65 antibodies were all negative. At this time, the hallucinations were thought to be due to autism, and she was prescribed risperidone 0.25 milligrams twice a day. Unfortunately, this did not improve her symptoms. From the time period of June 2020 to May 2021, she underwent trials of risperidone, olanzapine, paliperidone, aripiprazole, chlorpromazine, haloperidol, and clozapine. Still, the psychotic symptoms persisted. Sertraline was prescribed, which was efficacious for anger and dysphoria. Trazodone, melatonin, and mirtazapine were each tried in treatment of insomnia, but no significant improvement was observed. Therefore, each medication was ultimately discontinued. Due to persistent command hallucinations, in which the man instructed her to hurt others, the patient was admitted to Joe DiMaggio's Children's Hospital on July of 2021 for administration of IVIG. Repeat CSF studies and brain MRI at the time were unremarkable. From the time period of July 29, 2021 to August 1st of 2021, she received 3 doses of IVIG, which resulted in an improvement of her psychosis. Before the administration, she was seeing the man throughout the day every single day. She was only sleeping about 3 to 4 hours a night and having nightmares every day. On evaluation 2 weeks after IVIG was administered, she was only seeing the man 1 to 2 times a day, sleeping 6 to 8 hours a night, and having nightmares only 1 to 2 times a week. Her mood had also drastically improved. Below is a timeline of all the antipsychotic medications that were tried for the patient's psychosis. Her first antipsychotic was started on June 30th of 2021, and her IVIG was initiated on June 30th of 2021. Psychosis may be described by the presence of delusion, hallucinations, disordered thoughts, catatonia, and disorganized behavior. Interview-based studies have shown that the prevalence of psychotic symptoms in school-aged children is as high as 9 to 14%. However, psychosis does not automatically warrant a diagnosis of schizophrenia, as it may be related to other disorders, such as depression or bipolar disorder. For the DSM-5, diagnosis of schizophrenia involves the presentation of 2 or more of the following symptoms in a 6-month period: disorganized speech, disorganized behavior, catatonia, delusions, hallucinations, and negative symptoms. Furthermore, new studies have demonstrated that antibodies towards NMDA receptors is associated with severe new onset psychosis. Autoimmune encephalitis is associated with various antibodies against the neuronal cell surface or synaptic protein, which might present with a psychiatric picture and/or neurological deficits. The patient described demonstrated a severe case of psychosis that did not respond to a medley of different antipsychotics. Her case illustrates the potential use of IVIG for the treatment of treatment-resistant psychosis. Although the cause of her symptoms remain unclear, there were obvious benefits from the administration of IVIG that were not seen with trials of other medications. The patient demonstrates the need for further research of the use of IVIG in antibody-negative causes of psychosis.